Welcome to the Career Jitsu Podcast, where we connect the art of Jiu-Jitsu with your career. Our mission is to empower and inspire you with engaging conversations and valuable insights from people just like you who benefit from the shared relationship between your workplace and the art of Jiu-Jitsu, leading you to a more fulfilling and successful life.
Hello, everyone. Welcome to the Career Jitsu Podcast. We are so excited today. This week, our podcast is going to be from the bottom of our heart, and that is pun intended, because we have an amazing person. Dr. Jose Torres is a cardiothoracic surgeon, and he is also a BJJ black belt. Two worlds that he has found the discipline and consistency in to become great in both fields. And he is going to connect his profession, his medical profession of being a cardiothoracic surgeon, along with his practice of jiu-jitsu. So welcome to the podcast.
Hey, thank you for having me. This is awesome.
Yeah,
I'm
we
excited to
are
be here.
so excited to have you, Jose. If you took a look at Jose's resume, he is truly a Renaissance man, and just the confluence of his experience in jiu-jitsu, made it to the top of the mountain with jiu-jitsu, and his history in cardiothoracic surgery, which I could barely say.
Yeah.
It's so impressive, and we're so excited to see the intertwining of these things and how each one of these huge lifelong endeavors have helped the other as you progressed. So if you don't mind, Jose, can you just tell our audience a little bit about what cardiothoracic surgery is, how you got into it, what it is, and what you love about it?
Okay. So in short, cardiothoracic surgery is just surgery of the heart and the lungs. So I'm not a cardiologist, that's a separate field. That's in medicine. So surgeons, we're the guys who pretty much, quote unquote, crack the chest, divide the sternum, open it up, expose the heart, stop the heart. And we do bypass surgeries or we do valve replacements. We also do, some percutaneous procedures, but that's, the long and short. So I got into CT surgery because I've always been interested in medicine, since I was a kid. I love science, all that good stuff. Ended up in, biochemistry as an undergrad and went to medical school. And, it's there's a saying when you're in medical school, you hear about medical students say, hey, I want to choose my residency. And one of my mentors says, you don't choose your residency chooses you. So it's kind of like, just go with the flow and you're going to end up, where you got to be. And I ended up doing cardiothoracic surgery. So
I love that your residency chooses you. Basically, be the water and flow with your opportunities.
pretty much, yeah.
That's a beautiful quote. So obviously, there's no pressure. There's no pressure in your job at all.
No,
Just cracking
can't
over
be.
somebody's body. Yes. How did you? Now tell us a little bit about BJJ. What got you involved in that experience?
So I grew up in a small little town in New Mexico called Belen, New Mexico. It's about 35 minutes south of Albuquerque. Good, hardworking folks. My parents were teachers, uncles were railroaders. And we had to choose, a sport. I was a little too short for basketball, too short and small for football. But me, I had 3 younger brothers and, tons of cousins, and we all wrestled. So I joined the wrestling team. I took second my senior year in high school.
Wow.
And then I just happened to go on to the University of Notre Dame, and I walked on the team there because, I wanted, the camaraderie. And I think that's what a lot of the guys look for in jiu-jitsu now, as an older guy. So the camaraderie there, and I was able to work out. So we did that until the wrestling program was cut, unfortunately. So went to grad school, and started doing stuff like taekwondo, and but it just wasn't the same. You went to grad school, med school, and I started working as a bouncer, and there I met Greg Jackson and Tom Vaughn. These are old school.
Yes.
They didn't do Brazilian Jiu-Jitsu, but they did. At the time it was called Jiu-Jitsu. That's what Greg Jackson called it. It was his martial art. So I started training. It was just pretty much submission grappling. So I did that throughout medical school. Then I got into my general surgery residency at the University of Iowa. So I went out to Iowa City, and there was no Brazilian Jiu-Jitsu there. But there was submission grappling, out in Davenport with Pat Miletich and those guys. So I would drive down there like twice a week, just if I had a night off from call with a couple of guys, trained with Pat Miletich and those guys for, it was 2 years. And then a Brazilian Jiu-Jitsu club opened up at the University of Iowa. Initially, it was a Gracie Barra club. And
Hmm.
so that's where I first started, really liking the gi. Because whenever I was in Albuquerque with Greg Jackson, Alberto Crane was out there and he would go roll with us, but, I was a wrestler. I avoided the gi at the time, but I respected Alberto. The guy was just whooping on everybody. So here we have this new club in Iowa City. I joined, I got my blue belt there. And then I started training while I was, coaching, helping out coach run the club. And then I finished my residency, did my CT surgery fellowship. Oh my gosh. And ended up with my purple belt there. So it went from Gracie Baja to Pedro Silveira. And then, John Guda, he's a pretty big name in the Midwest. He's awesome.
Yeah.
He took over the club, formalized it. And then from there, I just, unfortunately, I traveled. And that's the reason, like, my journey was like so long to getting the black belt. So I got my purple in Iowa City. I was in Des Moines for a while, then ended up in Prescott, Arizona, training with the guys at, oh my God, it was a Mountain Tribe, Brazilian Jiu-Jitsu, Rob Johnson, Steve Judson,
Yeah.
under Novo União. It was,
Yeah.
oh my gosh, Hobson and
Yeah.
Gustavo Dantas. So I got my brown belt there. And then we moved back to the Midwest right before COVID. And I started training with John Guda's guys again, Matt Layton at Tipping Point Brazilian Jiu-Jitsu in Iowa City. COVID hit, that job went down the toilet, and I got the opportunity to go down to Davenport again, and I was training with Nate Fenton. He's Breaking Point. They're all under tag team. So I got my black belt from him and John Guda 3 years ago. And so
Wow.
here I am in Quincy. Well, I live in Quincy, Illinois. I started a CT surgery program in Hannibal, Missouri. So, and I'm currently training with a guy it's a Gracie Baja school in Quincy. Vitor Cortez is the black belt. So I've been training under a lot of guys, and it's just so frustrating, but I'm training with good guys. And that's the thing about Brazilian Jiu-Jitsu. People always ask me, well, do you not like training with Gracie Baja or tag team? I love Jiu-Jitsu, and I love that everybody has their own way of expressing the art. You know what I'm saying? It's just so different. You go from Iowa, wrestling dominated. I went out to Arizona. It was just totally different games. So you pick up, bits and pieces from everywhere and you just make it your own game. And the thing is, I learned with residency in Brazilian Jiu-Jitsu, and I mentioned this earlier, is you're in there and you forget about like all of the stress. Surgery residency was so stressful, because you rotate in, trauma, oncology, all that good stuff. And I would go to train and you forget about it. You're just, you're friends with everybody. Nobody cares that you're a surgery resident or, you're a police officer or, it's just nobody cares. It's just, hey, are you a good guy? Are you good to roll with? Are you a good training partner? That's what I liked about it.
Right.
You know?
Yeah, that old-fashioned saying, "Nobody will care how much you know until they know how much you care," right?
Right. Yeah,
So,
exactly.
yeah, yeah. Yeah, it's awesome. So what a great story, Jose.
I
Those are some amazing name drops right there. I didn't
Yeah.
even know where to stop you because I was like, wow. So your knowledge and experience in BJJ is phenomenal, and your experience as in your surgical residency as well. So both of those fields take a lot of discipline, a lot of consistency, and you have to find a way to master skills, right?
Right.
So mastering the skills of jujitsu, we talk about sometimes, when you get like a submission or you're working towards a position, having the right grip and being over, it's a game of inches sometimes, right?
Right.
And ensure that in your line of work as a surgeon, it's even a game of millimeters, I'm sure.
Yes.
Paying attention to detail is so important for you on the mats and in surgery. So can you help our listeners kind of visualize or understand what you're doing, like in terms of focus? Like how has jujitsu helped you with being able to focus in on what you're doing in surgery? And also has that residency experience or that experience as a surgeon, has that helped you understand how to break it down and understand details on the mats too? Can you talk a little bit about that?
Yeah, so I guess I can break that down into parts. Okay, so first is like the preparation. Because my CT surgery training and general surgery, the preparation was a long time. And then you get out into practice and you realize that, preparing for a patient's case is, probably the most important part of it. Like today I saw a couple of patients, I'm planning surgeries on them. I start preparing for their surgery, yesterday, whenever I was reading on their charts. I'm reading, okay, this is a young person, they need bypass surgery, you know, what type of, how many bypasses do they need? Are we going to do it on the bypass machine or off the bypass machine? Do they have good veins and, good conduit for the bypasses? Because the majority of the game, if you don't have a good plan going in, a game plan going in, you don't want to wing it. That's the thing. And that's the other thing that I learned, in jiu-jitsu. It's like, the last time I competed, I think it was in 2018, it was Phoenix Open. I took second, and the thing I learned from, Rob Johnson and these guys is have a game plan going in. So this was before I, you know, right before I got my brown belt. And they would always say, hey, you always visualize, and I got this from wrestling too, but even in jiu-jitsu, okay, the grips I'm gonna get. Okay. The first takedown I'm gonna get, the pass. Okay, the sub, where are you gonna get the sub from? And you kind of focus on that in jiu-jitsu. And it's kind of like the same thing in CT surgery. You go in and you have your game plan. And then I think as you become more advanced in jiu-jitsu, even in CT surgery, the more experienced surgeons, you start, you go in with your game plan, but not everything always goes as expected with your game plan, right? Like, for example, I could go in to do a bypass surgery, I'm bypassing a vessel, and there could be a big chunk of calcium in the area where I need to bypass. So at that point, you got to be able to like adjust,
Okay.
and you go back, you bypass distal to it, or you find a branch and you bypass that vessel. Same thing in jiu-jitsu, right? Everybody wants to get on top first, or for me, that's my game. Take down, get on top, pass, all roads lead to north-south for me.
Oh, you and Frank, man,
Man,
you guys have to roll together. That's his
we
move.
do.
Yeah.
That is my move too. North South is the most comfortable place you can actually be. You could nap if you need a little extra oxygen. It doesn't take a lot of energy to keep it controlled, and it's just such a nice slow finish. Yeah,
And
Yeah. And
yeah.
you're
Well,
completely
brilliant
on the other
people.
side of the
I
hips.
must have the mind of a surgeon,
yeah,
obviously,
maybe,
if we're
maybe,
if we're
it's very,
thinking alike.
it's very technical. And like I said, so it's like, I put that example in bypass surgery, but like, let's say something bad happens, like you get a, aortic dissection comes in, those things don't follow, the book, right? Worst case scenario, you go in, and the thing that I learned in jiu-jitsu is you always take it back to the basics. Okay. So in heart surgery, I want to normalize the anatomy as best as possible. They have a shredded aorta. I have to replace that aorta. Okay. And we have special conduits. So you take it back down to the basics. You go to the point, to where you understand the anatomy and where you can start from scratch. And so you always got to be able to do that. If you go down the wrong road, it's a bad place to be in heart surgery, because like you said, you can't make mistakes. General surgeons, bowel surgeons, if you sew up some bowel and something happens, if it leaks, you can always go back and cut more off and re-sew them. Coronary arteries, right? They're very small, very minuscule. It's millimeters. So if you screw up, it's very unforgiving.
Yeah.
So,
So
Jose, is that
yes,
like something that you would contrast? Because in jujitsu, we always say, make mistakes. That's where you learn. Like Jason always tells us,
in
either you
training,
win or you learn, right? But
yeah,
in your position, when you're performing surgery on somebody's heart, you really don't have the luxury to say, I learned today. He died,
it's somebody
but I
else's life.
learned.
It's somebody
Right,
else's life.
right. So do you find there's like a little bit of a contrast in the mind?
No, the philosophy I take from it is there's always a way out,
Okay.
right?
No such thing as a bad position. Like that's what Jason always says.
Yeah,
Right.
Every position has an opportunity.
there's
Right.
always a way out. Okay. And that, I have 3 kids. all three of them do jujitsu. I have a 14-year-old, a 12-year-old, and a 9-year-old girl. And that's what I tell them. I was like, don't freak out in the bad position. There's always a way out, even if it means tapping. That's a part of it. It's like sports in general, like wrestling and jujitsu. Everybody wants to win them all, but unfortunately, some, you got to tap out, and that's the way I
Yeah.
look at it.
Yeah. Yeah. That's
Right.
awesome. Frank, you were talking a little bit earlier about, I think you used the word precision when you were talking about his job. You were saying how, he has to have precision. So,
Yes, thank you for mentioning that, because there's something else he said too. He said in his experience, what he's learned from surgery is the small details are what determine the big outcome,
Right.
and that level of precision. So can you talk a little bit more about that?
So in heart surgery, I'm sewing, we call it, it's smaller than fishing line. It's like a 7/0 purling. It's like the suture's the thickness of your hair, and if you go too deep, you tighten up that anastomosis too much and they're not going to come off the bypass machine. Or, you can mess up the conduction system, which regulates, the heart rate. You can, you know, kill somebody or, maim them for the rest of their life. So precision is totally, of utmost importance. Because in jujitsu units, like I learned, it's, if, from north south, I love, I guess you call it the bread cutter or paper cutter choke. That's what I almost always go at. It's near side under, go around. If I get the grip too deep, it doesn't work. If I get it not deep enough, it doesn't work. You have to be in that sweet spot. And I think everybody has their favorite move and they know that there is exactly, one grip position where it's going to work all the time. They grab it and they're like, they
Yeah,
smile.
it's
They
over.
know
They
because
know.
they know they
They
have.
know.
right.
And that's pretty much the same way it is with open heart surgery. Like if I'm doing a valve replacement, and I open them up and I get in there and I know that once they take out, at a certain point in the surgery, I'm like, okay, I know that I'm good from this point because
Yeah,
I've done
you
all
you
the
take
steps.
that breath. Yes, that feeling of, okay,
Yeah.
we've crossed the Rubicon. We're good.
Yes.
The Rubicon
You,
of safety. Yeah.
right. And that's the
So
way it is in both.
so now with cardiothoracic, there's a lot because you also do lungs as well, correct?
Yes. Yes.
So having so much to concentrate on, not just the heart, does that present its own set of challenges?
No, because that's pretty much all I focus on. So if you think of the lung surgeries, right? It's once you've mastered the anatomy and there are variations, you just got to keep following pretty much like the same steps all the time. You don't reinvent each surgery. It's like for me, the bypass surgery is pretty much done the same way every time. Aortic valve surgery done the same way every time. In the lungs, we have, 3 lobes, right? We have 3 on the right, 2 on the left. I do the surgery for each lobe the same every time.
Okay.
And people are like, oh, they're like, oh, heart surgeons are the biggest jerks, or excuse me, I don't want to say, people say assholes, excuse my language, but the thing is we get very comfortable with our routine because it's a safety net. It's like, I know that if I do it this way, it's going to work the majority of the time.
Mhm.
And not every surgeon does it the same way. Everybody has developed their own system
Sure.
for each of these surgeries. Because I mentioned, there's so many different ways to do different things. But the thing is, each one of us has like developed our own system to do our aortic valve surgery or our mitral valve surgery or our lung resection. So it just gets, if something happens where somebody throws a huge wrench in your system, yeah, you're kind of like, okay, time out, stop. We got to go back to the beginning and get it towards, something that I'm familiar with that's more familiar to me, like my system.
Right.
Right. Back to your basics, back to your fundamentals. And I think it's really interesting because something that my coach Jason always says is the broad principles. Don't get so caught up in memorizing every little different detail. If you understand the broad principles wherever you find yourself, you're
Right.
Yeah.
Right.
Yeah. Principles and anatomy, right?
That's
Jose,
it.
like, understanding the anatomy and understanding the principles of, leverage, timing, things like that, are just impeccable, like you always can go back to them. You can always revert back to those basics.
That's it.
Yeah. So Jose, we have one other thing that just I thought of is the fact that, we just talked a lot about what the physical part of things. And now there's also the mental composure that you must have to have. I'm sure that it's a very I mean, how many there are a lot of different medical professionals in a surgery room?
So in my room, okay, so there's me, the heart surgeon. I have the anesthesiologist. They're a cardiac anesthesiologist. So they did additional training above and beyond their general, they did medical school and anesthesia residency. And then they did another several years of just, heart and lung anesthesia. And we have a perfusion team. So this is the guy that runs the bypass machine. And then we have, 4 or 5 nurses who are trained to do, specialized, open heart surgery nursing. And so that's just in the
Okay.
operating room. And then in the ICU, we have specialized
Wow.
ICU nurses, so to help manage them post-operatively.
So there's a lot of things going on, a lot of different roles being played at the same time, and you
Yes.
have to try to keep all of that together and maintain your composures. Can you talk a little bit about that and how you if jujitsu has kind of helped you with that part of it?
Yeah, it is pretty stressful. So, the problem with I'm not even gonna say a problem. It's I guess, a lot of us surgeons, we like this I don't know if it's a control thing, but they see you as like the captain of the ship. So, okay,
Mm.
the good stuff, hey, you get everybody cheers you on. Something bad happens, hey, you got to take responsibility for all of it. Jujitsu is how well just with the stress relief aspect of it. For one, I know if I have a bad day, I go out there and I roll. People don't care that I'm a heart surgeon. You totally forget what you were doing the entire day because it's just you got to be all there, all in the roles, or you get subbed, or you can get injured, or you can injure somebody. And that's the same thing with the heart surgery team. Is you got to be all in. Um, you got to be good with your, the people who you are working with. It's kind of like training with your partners. If you go too hard, nobody's going to want to train with you.
Right.
Same thing I've learned with the nurses or the anesthesists. You can be the biggest jerk, you can have the biggest ego. And eventually people are going to be like, hey, I want to avoid that dude,
Yeah. Yeah.
which is
And
not good for the
people
patient at all.
yeah, and they're going to succeed too. The more that you're, positive with them, they'll succeed too, which is going to help you in the long run too.
Right.
Yeah. And being adaptable, right? Like you talked a little bit earlier about how, in those, there are complications that can happen, right? You have to keep that calmness under pressure and be able to adapt. So
Right.
can you talk a little bit about that adaptability part of things for you?
Oh, well, so like I said, so with the Brazilian Jiu-Jitsu, right? Like I always said, there's always a way out. So you got to keep, you know, a decent mindset, right? You can't get so flustered that you don't see, the signs, where you need to go next. Same thing with CT surgery. It's really easy to get flustered. If you start panicking, your nurses start panicking, your PAs start panicking, anesthesia starts
Mm.
panicking.
Right.
So the surgeon has to stay calm and has to lead. And it's the same thing when you're rolling. Somebody gets you in north south, right? You need to say, okay, this is a really bad position, but I've been here hundreds of times before. I know a couple of good ways to get out of this, and flip the script on my opponent. And that's the same thing with open heart surgery. You could get into a position, and like I said, with all of the training, I was 38 when I finished my CT surgery training. So that's how long it
Wow.
was. Yeah,
Wow.
yeah,
Half a life in there. That's
yeah. It
quite a
was
commitment.
right.
Mm.
Yeah.
And the thing is, it's just like Brazilian Jiu Jitsu. I went out and I learned from my first partners. These have been guys who've been doing it for years. I thought I knew everything, but then you start operating on your own and you realize you don't. So you start listening to the senior guys, or the smart surgeons do. They'll start listening to their senior partners who say, "Yeah, the books say it this way, but this is the best way to do it." So you got to humble yourself a little bit and learn and realize that you have to continue learning, which is the same thing in jujitsu, right? I got my black belt, and you're like, "Holy shit, I really don't know that much." Saying that's the way I
Mm,
felt.
That was one of the questions I was going to ask you. You just like segued right into it. So you're a black belt as a master, and
Yeah.
obviously you're a surgeon. You're the director of the surgery there, correct? Director
Yes.
of cardio. Yes. So you are at the top of two fields. Do you still feel like a student in these things?
Yes, I do. Always. CT surgery, like I said, there's new technologies coming out. Transcatheter valves, for the aortic valve, the mitral valve, those have continued to develop. And I still I go away for 1 week a month. I go to Dubuque, Iowa, so I can keep my hand in that field, in that segment of CT surgery, because it's going to continue to develop. And as a surgeon, if I don't keep doing that, eventually I'm not going to be able to offer my patients here in Hannibal that technology, which is standard of care. And it's the same thing in jujitsu, right? I think I'm pretty good at my half guard, which is my game. I do half guard, go to dogfight, sweep, pass, it's the same game. But I've been trying to develop, more of a butterfly half, more of a butterfly. It's just because you can keep learning. Every now and then it's like, rolling with my son once, my gosh, he got me in a baseball bat choke. The
That's
thing
a
is,
Oh,
he's my
those are
sneaky
kid.
the
one.
worst. Those are sneaky. Those are
Well,
the worst.
From the bottom, Jose, or the top?
oh no, we were standing up,
Okay.
A
and
stand-up baseball bat joke.
I didn't respect his grips.
Yeah.
All that happened next is I woke up.
What he put you to sleep?
Yeah, because being, a knucklehead dad, I was like, yeah, I didn't
Yeah,
respect
I'm
it.
not going to give you this. Yeah,
Yeah.
and you
Yeah,
probably like, I'm not going to give you this. I'm going to get out.
yeah. The
I
poor
mean,
Yeah.
kid
this.
thought he killed me.
Yeah. It's like it's humbling, it's a humbling martial art, and also in your medical professional, it's humbling. In profession, it's humbling too. Frank,
Right,
you've talked about that two-sided coin about confidence and humility, right?
right,
Jiu-jitsu will build your confidence, but every once in a while, it also makes you feel that humbleness as well.
right. Well,
There's
which is the same thing in heart surgery. Because it's the same thing. You could be doing really, really well, right? You have a nice run of surgeries. No patient deaths, no bad outcomes, and then you have a patient that you can't save.
Yeah.
And
Yeah.
there's a saying in heart surgery: you're only as good as your last case. And
Mhm.
so you got to realize, you just got to stay humble, keep learning,
Yeah.
and keep
That's
moving
awesome.
forward.
Yeah, definitely. Yeah. I mean that ability to learn, just it will help you grow, and you become a better surgeon because of that, and you also become better on the mats because of that, having that open-mindedness. It
Right.
just, yeah, it's an important part of the game. Frank, do you have anything like from the teamwork concept? Like, you mentioned about him being the director. He has a lot of people in that he has to kind of manage and schedule and have meetings and so forth. So, do you have anything like in terms of the
yeah,
social
y-
part of it?
y- yeah. Like one of the things I wanted to ask you actually is, you said you were an instructor, right, of BJJ, or
Yes.
was it? Yes. So being an instructor in the field, and also now you're leading a team. Have you learned a lot from being an instructor, and and
Mm,
finding people's strengths and putting them in the right places so they can learn? And has that transferred over to your practice in the medical field, in the surgery?
Yeah, because in Brazilian Jiu-Jitsu, it's like initially when I was a blue belt trying to do this, I would try to show people what I knew the best, and it's trying to force everybody into that same little box. And then
Yeah.
you realize not every, and even now with my kids, I try to show them stuff, and not everybody learns the same way as you learn. Everybody has their own strengths, and as in the good instructors, okay, because I'm not saying I was a good instructor, I tried, but the good instructors realize that, okay, you identify, your students' strengths, you know how they learn best, what positions they're best in, and then you go from there. You may have a kid who's really good at close guard or spider guard. So you try to help them out, you know, to direct them down those paths. And it's the same thing, when when I started the heart surgery program here, you try to find the strengths of each member of the team, and you understand that everybody learns differently at different rates, and you cannot force people down a certain path because you're just setting them up for failure, right? That's just the way it is. You can't force a kid who is afraid of getting taken down. You can't force them to do takedown all the time. You can teach them ways to get over that fear initially. And you can also take them, okay, or teach them. You can say, hey, but if you do get taken down, this is the guard you go into. This is what you do.
Right, right. So taking instruction more at an organic level than
Yeah,
a
totally.
preconceived. Yeah, yeah. That's good. I'm a teacher, so I totally understand that.
Yeah.
I
See,
think
both my
that's
parents were teachers. They taught high school and middle school, and that's, I think I got a lot of that from them. It's
they pass that down. Yeah. That's
yeah.
such an important thing. I do want to go off track a little bit because I saw and you mentioned that you were a bouncer. Do
No,
you have
gosh, yeah.
any interesting anecdotes from the days of bouncing and how your martial arts may have helped you?
So it kind of sucked because I'm only like 5'5.5". So I'm working with these. This is in Albuquerque, and these are these bigger, taller guys. And I was always the guy that had to go and tell, these big cowboys or whatnot, and say, "Hey, sir, you got to knock it off, or you got to leave." They'd look down at me and say, "What are you going to do?" So I try to talk them down. That's you try to avoid the fight,
The
but the thing
escalation.
is, it would escalate. And I learned, I tell my kids this: if you know the fight's going down, you don't let them get the first punch. Because there was one time this happened, um, and he didn't get the first punch. He almost did. He grazed me, but I took him down, and like a dummy, I didn't take off my glasses. So this guy just grabbed my face, and he wasn't letting go. I had him in an Americana at the time, and I was like, "Man, if you do not let go of my glasses, I am going to break your hip and arm." And he wouldn't let go, so I just started torquing, and then he stopped. And that's when I learned, it just hits you, wrestling, closing the gap, getting on top, and ending it that way. I didn't break his arm, could have, but we stopped
Right.
it. And he was out. And, got my friends, the other bouncers, they came and helped me escort him out. So that's one of the things I learned. And I do worry about it. A lot of people always talk about, the no self-defense aspect in jiu-jitsu versus sport. The one thing I learned from the guys in Prescott, it's just the intent. People say, hey, if you go in there with bad intentions, whether you're a sport jiu-jitsu guy or a traditional self-defense, I think jiu-jitsu is going to help you no matter what. So you just always got to realize where you're at, know your environment.
Yeah, awareness is a big piece of it,
Yeah, that's all it
obviously.
is.
Yeah, yeah. Awareness itself is one of the best self self defense techniques that there are.
Yeah, totally. And like I said, try to get out of the situation. I tell my son, if you know it's a bad situation, you do not get involved in it. It's just total. But sometimes, unfortunately, it's going to go down. So you do your
Yeah,
best
somebody
to.
grabs you and you can't get away. I mean, I tell my students, the runners, the track kids, you have the best self defense of anybody.
Right. Yeah.
You can do this to somebody and then run.
And
They
run.
can't catch you. Nobody's going to catch
Right.
you. You're so
Right.
fast. But if somebody does grab you, once somebody grabs you, obviously that's when wrestling or jiu-jitsu or any of the martial arts, you're glad you have it.
Yeah. And actually, I saw a Jocko podcast once, and he says, if somebody touches me, welcome to my world or something like that, because he can, once they grab him, you can grab
Yeah,
them back and you control them.
right. Right. I
You know?
saw that too. I think he said in that if somebody says something to me or tries to humiliate me with their words, I'm walking away. I don't care who you are. I don't care if you look like I could crush you with one hand. I don't want any
Right.
of that. I'm
Right.
walking away from that. But if you grab me and I can't walk away, now I have my tool set to take care of that.
Right.
Yeah.
Yeah.
That was a good podcast. Yeah, we should link that somewhere
Yeah.
in the
Totally.
description. Yeah, that was a great one. So one other question for you, and I know I'm going a little bit all over the place. How much do you feel your wrestling helped you in jujitsu?
A lot. A lot.
It bailed you out, right?
It bailed me out. So initially, like I said, I was training with Greg Jackson and these guys. I just take guys, I could take guys down. And that pretty much dictated my entire game because I consider myself a guard passer. I always pass to half guard, kind of like Marcelo Garcia. He has all these instructions on that. And then, I either get to side control, north, south, but that's the way I've always been. And initially, a lot of the jiu-jitsu guys had a harder time dealing with the wrestlers, especially once they learned submission defense. And I think that's changed recently in the recent years because there's a lot more cross training. But way back when, this was 98, 99, Grappler's Quest, was big then. The wrestlers, they take guys down and and unfortunately, they could stall. That was a problem. People didn't know how to deal with it. So it helped me quite a bit. But the problem is I developed that game, throughout my career. And now I'm older. I'm 52. I'll be 53 this year. I've had both my hips replaced. I'll need a knee replacement.
Wow.
So my mobility on my
So
feet
you're not doing
is
as many double leg blasts.
exactly. That's the problem, So
Right.
and I hate to say this, but sometimes I'll pull the half guard and I'll wrestle up. You know what I'm saying?
Right. But good for you for being able to wrestle up from half guard because that's not easy either.
Yeah. Yeah.
That takes some energy too. That's not just
Yeah.
like a gimme sweep. That's a wrestling up dogfight. You said that's part of your game. That's not.
Yeah.
That's definitely not an easy game either.
No, it's not.
So
Yeah. Yeah. And it's great that those two disciplines, wrestling and BJJ, combining the two together really helps you be more effective, with the understanding control and stuff like that. And
Yeah.
so also not in just in surgery, but in your line of work, do you take any like interdisciplinary approaches to things too? Do you try to bounce things off of other disciplines and to help you grow and learn as well?
Oh, most definitely. So nowadays, well, and this is just recently, especially, I mentioned the transcatheter valve therapies. So now it's called a structural heart team. So it consists of the cardiothoracic surgeon, the interventional cardiologist, the cardiologist, and the patient is actually, part of that team. So in the old days, patients would come to me and say, "Oh, you need a surgical aortic valve replacement." Nowadays, primary care doctor sends them to the cardiologist and we all discuss it together. And, it's a team concept. We have the pulmonary critical care folks involved, cardiac anesthesia, and we say, "Hey, what's the best procedure for this patient with this pathology?" Older patient, we're like, "Oh yeah, let's do the minimally invasive, transcatheter valve." Right? Younger patient, fairly healthy, we expect them to have a long life expectancy. We can do a surgical valve because those will last longer. And it's the same thing with, my lung patients. We have, these multidisciplinary tumor boards. We have oncologists, radiation oncologists, pulmonary doctors. And so it's not just me sitting there, "Oh yeah, you need your lung taken out." We
Right.
talk with the entire team and they'd be like, "Oh, this is, Mrs. So-and-so, she's old. She's smoked all these years. Her pulmonary function isn't good. I don't think she's going to tolerate surgery." So we come up with a plan, whether it's surgical, whether it's radiation therapy, so yeah. So, and, to all your listeners, they should, if they need medical or surgical work, always make sure that, the doctor you're speaking to is part of a team because that's the way you're going to get the best, healthcare or surgical care.
Yeah. And that relates to the mats too, right?
Yeah, totally.
Yeah.
Especially with, and it's like I said, it's in the mats. It's the way I see it is if I want to get better at something, like I said, butterfly, butterfly half, I find the best individual in the room at that move,
Yeah.
whether it's a black belt, a brown belt, or a purple belt. And at my age, 53, I have a hard time with the purple belts. I tell everybody, if I don't get you in the first minute and you get on top, we're going to be struggling. I'll probably, wiggle out of it, but I won't get a clean kill unless it's like within that first, because I'm older, it's crazy. So I will go to some of these younger guys and say, "Hey, how did you do that?" And because you got to let go of the ego, you want to learn how to do this.
Right.
Some of these guys, all they do is stay home and they watch, John Danaher DVDs, and they memorize the things. You know what I'm saying? And I was like, "Hey, I like
The Jiu-Jitsu kings.
Yeah, exactly." So
Yeah. Yeah. We could talk forever here, Frank. This is an amazing podcast. I love it.
Yeah,
I do have one more question. I just got to get in there
Go
Get
for
it
it.
in there, Frank. Get it in there.
You in some of the, I was looking at some of the text that we were sending back and forth, and I love that you said this, and I just want people to hear it really as a plug for the benefits of jiu-jitsu. You said, and this is coming from somebody who does surgery on the heart, so it means a lot, that BJJ is an excellent health benefit for your body and your mind. So can you
Right.
just talk a little bit about that benefit for our listeners? We have a lot of listeners who don't do jujitsu, but they love to hear the wisdom that comes from the mats. So can you
You know,
just give a little shout out to from a medical perspective of what it does for your body and your
so
mind?
from a medical perspective, it's like it encourages a lifestyle where you want to stay active, healthy, and you can go deep down this rabbit hole, but the majority of people that I've met in Brazilian Jiu-Jitsu, you know, I've met guys who were smoking, and you learn that if you're smoking, you start losing your wind, you're not going to be very good at it. Well, as a CT surgeon, we always tell people, hey, be active, walk as much as you can, do cardiovascular workouts. And recent studies have come to show that, hey, strength training is actually better for older guys, especially diabetics. And Brazilian Jiu Jitsu, you get all of that. You get the cardio workout as you're, even the warm ups. People, purple belts don't want to do the warm ups, but depending on your school, they're good for you. They help you warm up. Just the rolling, if you think about it, if you do 4 or 5, 10-minute, 20-minute rolls, you are doing a huge cardio workout. If you're working out with older guys, they get on top of you. You're doing strength training with that.
Yeah.
So it's just been an awesome workout. I push, my wife gets mad at me because I meet people and I'm like, yeah, you got to put your kids in jujitsu or you got to do Brazilian jiu-jitsu. And, and people do worry, how about the injuries? Yeah, you can get injured. I remember one of the guys when I was a surgery resident, he goes, oh, you're going to break your arm. What are you going to do then? You're a surgeon. And I swear, I'm not joking. I'm not exaggerating. A couple of weeks later, he was riding his bike to work. He hit a curb, flipped the bike, broke his
No, he
collarbone,
broke his
broke
arm.
his arm.
Ah,
Can get injured doing anything.
Yeah,
so-
and that's what I'm saying. So, and the thing is about jujitsu is like, you can get in there, you can get a good roll. And like I said, I'm an older guy, so I'm cutting back. I try to be, I try to do hard, intense stuff initially, but I'm very selective with who I roll with. I roll
yes.
with, I roll with the black belts, right? And the brown belts. And they know, okay, this guy, you know, Torres isn't going to be like, trying to kill me because they respect that. But, you start going with the white belts, who are trying to prove something, they
Yeah.
spaz out and, they
Yeah.
don't really understand the positions.
Right. We say that all the
Yeah.
time. The white belts are the ones
Elbows.
who cause the injuries
Oh,
more
yeah,
than
The
the
anything.
elbows
spazzy
to the
white
forehead,
belt with the elbows and the pokes in the eyes and the kicks to the
the,
groin and the
the long
oh
fingernails.
oh yeah, the long fingernails, the long toenails, and sometimes the unwashed gi. Yes,
Yeah.
we're not beating up on white belts because they're
No.
we
Yeah.
love white belts, but
Right.
they can be spazzy. Yes,
Yeah.
definitely.
And they're future training partners. And, we just got to teach them, that this is the way you do it. And,
Yes, a
flow
hundred
roll.
percent.
You try to show them how to flow roll, and they do well for the first 30 seconds. And then after that, it's like gladiator challenge, that kind of stuff.
Yes, they're going 150%. Yeah,
But
100.
at the
Yeah,
same time, you try to nurture them too, But the most important people on the mats are your training partners. So if you nurture those white belts, they're going to grow into good practitioners as well. And that's
Yes.
very similar to in your job too, right? You
Right.
want to help those people that are in residencies and guide
Medical
them.
school. Yeah. Yeah. And that was one of the problems with CT surgery in the past. CT surgery was like, oh, I'm the most hardcore, oh, let's weed out the weak. So they made it to the point where like nobody wanted to go into CT surgery. It was just nobody wanted to work,
Yeah. Then where's
you know,
your future,
20 hours a day, 7 days a week. Nobody wanted to do that. And they finally like, it's gotten better. And I think the numbers are better going into the field, but still you got to train them because, as I said, I'm getting older. One day, hopefully I don't need one, but if you do, you want to have a good one.
right. 100%.
Yeah.
100%. Jason, we have so
So
many
many takeaways, right?
points, too many takeaways to really fit in like one episode. This has been like so stock full of just interesting nuggets and wisdom. So, do you want me to wrap it up? Do you have any final questions?
About jujitsu and CT surgery. I'm just going to say that like jujitsu has kept me sane because
Mm.
there were times when I wanted to quit fellowship. You know, I remember there were some times where I went. So in Iowa City, we had the jujitsu classes were in the field house, which was attached to the hospital. So I would be, I'd be rounding, doing surgeries, and it would be like 7 p.m. at night. I could walk over to the field house and train. They have pictures of me falling asleep on the mats after jujitsu class at 8 p.m., 9 p.m., just late at night, and jujitsu saved my life. I think the majority of my friends I made through jujitsu, you know, don't get me wrong, there are a lot of really cool folks in CT surgery, but I met the most down to earth guys in Brazilian jiu-jitsu. If you think about it, you got to trust these guys. If they get a choke on you, they're not going to, keep going until you're dead. You got to trust them. And jujitsu has been awesome, and I have my kids in it. They like it sometimes, they don't like it sometimes, but you know, it's really good for them, and I think it's good for self defense and discipline.
I think it's great that you have your kids in it, and I hope you get a chance to listen to our podcast with Jose and Anna, who a
Okay,
father and daughter who's like they just built a great bond through jujitsu. So something you might want one of our podcasts that you might also find.
actually, I
It
might
just
look at.
talks
Yeah,
about the
I'm definitely into that.
yeah, it's such a nice thing to do with your kid. Just a great way to
Well,
build a bond.
and the thing that, man, it's just like I said, I got choked out by my son. It's just crazy because like you see him as a little kid, and then all of a sudden one day you realize, holy crap, he's a young man, and it makes
Yeah,
me feel good that he can actually like go in and fairly he can take care of himself if he had to. You
yeah.
know what I'm saying? Um,
It's a good feeling for a parent to know that their child is number one aware, so hopefully will
right,
never need it. But number two, if they ever need it, they have it.
right,
That's a gift
definitely,
for both of you, right?
yeah,
It's a double whammy gift.
yes, totally. And
Yeah,
that's been one of the blessings with Brazilian jiu-jitsu, And the other thing I tell everybody, just, like with healthcare, if you are getting a medical or surgical procedure, find the best team, that can give you what you need. Same thing with Brazilian jiu-jitsu. People are always, I think, hung up on, you know, teams like, whether, Alliance or Baja or tag team, you know, find the school that fits you the best, you and your family the best, because that's the way you're going to learn, where you fit in, where you feel comfortable. That's the best thing.
right. Nobody does it alone. Everybody needs a
Nobody,
team.
definitely.
100%. So
Yeah.
Jason, I have probably too many great things in our wrap up to fit in a wrap up. I have so many notes here, but I'm going to try to hit the ones that I thought were most pertinent and that our listeners are really going to benefit from. I'm gonna start out with I just loved your like early quote of your residency chooses you. I just thought that
Yeah.
was great. And I'm a teacher, and a lot of my kids are so stressed about where they're going to go to college, what they're going to major in. And I am going to use this as your career will choose you. You'll find the right people. You'll find your spark, and to be the water so that you can flow and it can come to you. I think
Yeah. And I think that was a Hickson Gracie quote, right? Flow with the go. Or like people say, go with the, he said something like flow with the go, it's just, you do your best, you build yourself up, you get all the tools that will help you, when that opportunity arises. That's what you need. That's same thing with training in jujitsu. You pick up your game, you develop your game, and eventually, you're gonna be rolling and things just present themselves and you can grab them and go from there. That's the way I look at it.
it is the flow. It's a way of the universe. You got to ride
Right.
it like a wave. Another thing you said that all of our guests have said emphatically is it's you actually said jujitsu saved my life. And you said that it was your stress therapy. It was your way to be forced to be present in the moment. And I really thought it was cool because when you were saying like you went here, then you went to this other state, then you're in Iowa, and you always found a gym and you were
Yeah.
practicing to get your degree. I was like, damn, the tenacity of this guy is very impressive, which it is. But then you showed the other side of it. You're like, that's what kept me sane. That
Right.
wasn't like taking away from my ability to get my degree. That was enabling me to get
Right.
my degree. So I thought that was just a great thing to throw out there to people who say, I'm very busy. I'm very busy. Well, this is going to help you deal with the busy. This is going to help you
Right.
deal with the stress. So I
Yes.
just love the way that you framed that. That was really nice. You talked about preparation, and I'm going to share a vocabulary word that I've used with my kids, anti-metaboly. You said preparation is important, have a game plan. And the quote that it just brought to my mind is if you fail to plan, you plan to fail.
To
That's an
fail.
anti-metaboly. Cool word, right? And you gave us a great example of that. And
Who was that
being
football coach that said that? Oh my God. Real famous guy.
I
Green Bay
won't know because
Packers.
I know nothing about
Yeah.
sports. That would be a
Yeah, no,
Jason.
no. Who was that? There's a real famous Green Bay Packers coach. This is horrible because I'm not into football, but I know he said that.
Was it Vince
Oh,
Lombardi?
Vince Lombardi said that. That was
Oh
a
my
quote from
God, I
Vince
cannot
Lombardi.
believe I got that. I
Yeah, you
cannot
got it.
believe I got that. My
that's
my
impressive, Frank.
students and my peers, I'm making everybody I know watch this because nobody believes in my ability to know anything about sports. So yes,
Right.
that's a great quote. And you kind of exemplify that in what you do. I love that you also said back to basics when things get hectic, when you're like, holy crap, I'm the leader here. I have to stay calm. You go to your fundamentals, you go back to basics in your own words, start from scratch. Let me go to where I know, and I will be able to get out there. I will be able to get out of this because, and I like this also, you said there's always a way out.
Right.
And I find that inspirational not only for jujitsu practitioners or people in a tough career, but some of our listeners are probably struggling in life right now in some kind
Right.
of darkness against some kind of monster. And it's just great for them to know and to hold on to that quote of there's always a way out. That was
Yes, for sure.
sweet. And I have I have so many here. I'm not going to go on to all of them because I have too many. You talked about leadership. One of the things I love that you said is always be a student. You're a guy who has a black belt. You're a guy who's a surgeon and you run the surgery and you are saying, no, no, I'm a student. I'm always a student. I'm always going to remain humble and open. And that's inspirational to see that you've got all these
Right.
accolades, all these things that you've done, and you're still open minded and trying to learn new things. That is what life's about and jujitsu is about. And I'm just going to close because I know I'm bloviating. I'm going to just
Okay.
close with one of the best things that you said for our listeners, the health benefits of jujitsu. It's going to make you a healthy person. It's going to make you healthy physically, mentally. It's going to help you in your career. And I just want to toss that out to our listeners who are maybe thinking about it and haven't done it yet. It's a strong sell, but it will give you a return on its investment.
And the one thing I will say, so I said that I push this on I recommend it to a lot of people, but the majority of people that I have recommended this to and who actually joined have stayed in, and that's the thing. If you think about it,
Testify.
especially, men, it's like, I think it's a good thing to do for men because it's like the camaraderie, you know, everybody's respectful, if you have, you'll always find somebody that you can talk to or speak with, you know, before training, after training, even after the rolls, like between rolls, or, it's just been an
Yeah.
awesome experience in my
It
life. And it was one of the best things I ever did.
it
And
becomes your family. It becomes your
Yeah,
yeah, and
family.
that's
Your
yeah,
yep.
second family.
totally.
And it extends. We talk about this all the time, Jose, is how it extends into your personal and professional lives too. You can, it branches out the principles and the mindset that you learn through jujitsu. It branches out into your career.
Yeah.
So that's what this podcast is about. And you were gave a great explanation of that because you are a culmination of those things, right?
Yeah, no, I
Yeah.
appreciate, and like I said, I don't know, everybody always worries about imposter syndrome, it's like, and that's why I always want to learn because, it's like you're always thinking, okay, I'm just this little guy from Belen, New Mexico, And I just want to keep developing and, just have faith in what whether it's jujitsu or heart surgery, because at the end of a cousin told me this, at the end of our lives, when we kick the bucket, you can't take any of the physical stuff with you. And this is really interesting. He goes, but you can take, probably, he's thinking everything that you put in your mind, right?
Yeah.
All of your knowledge, all of your experiences, because physically you can't take it, but the mental stuff, the emotions, it's what you take with you.
Right.
Right.
Yeah. Yeah. It's
Right.
wisdom right there. Wisdom dropped right
A
there.
lot of
Yeah.
wisdom.
Well,
That was
yeah.
just amazing. Just amazing.
Well,
So
thank you so much. I'm sorry. You got like a few more things, Frank, or
no,
you
I
get-
just wanted to say, I hope we get to meet you in person sometime. Are you ever
That'd be
in
awesome.
like you ever in Massachusetts?
No, but I can take the kids there and train. I go to New York every couple of years, for a couple of conferences. Maybe I can get out to Massachusetts.
yeah. Anytime
It
you
would
head to
be
the East
great.
Coast,
And
we'll try to work something out.
we'll show you Boston. Like we'll bring you to Boston, you and your kids. We'll do
Take the wife
something.
and
That would
kids.
be great. Seriously.
Yeah.
And then I know your north south will probably crush mine because I'm a mere blue belt, but it will be fun
That's
to work north. It would be fun to work north south with you, and I'm sure
It's
I could
awesome.
learn a lot. Yeah.
That's
So
awesome, guys.
please make sure you look us up when you are in the area, and we will all
No,
go
I
out and do
will.
something fun.
I have your
And
text, contact information, so you can do that.
and being a
yes.
surgeon, we know how busy you must be. So thank you so much for cutting out an hour of your very valuable time and sharing this with all of our listeners. We really appreciate that. And we also want to shout out to our listeners. You guys are like following us from all parts of the globe. Please keep sharing this. Share this with your best friend. Share this with somebody who doesn't do jujitsu and you think can benefit from. You just got wisdom from a black belt and a surgeon. I mean, about life. So
Yeah.
please share this.
Yeah. Let's
We
keep
love
this
our
growing.
listeners
Yeah.
Thank you all.
and all men and women. Make sure you join a
Yes.
jiu-jitsu gym, right? Make
Yes.
sure you do that.
Encourage your children to do it. It's awesome.
Yes, 100%.
All right.
All right, thank
All
you
right, guys.
so
Awesome.
much.
Hey,
Thank you so much, Jose. All right.
All
Take
right,
All
care.
guys.
right, take
Have a
care.
great weekend. Okay,
You too,
bye-bye.
Peace
guys.
out.
Bye.
Bye bye.
Peace.